topic of discussion for today is education and health, and we know how important that is to the average Nigerian. In fact, all Nigerians. We've been having lots of discussion, and every day we hear that when there is a plane crash, of course, there is always hoopro. Everybody, the whole country will be grounded because we all feel the pain. We feel the pang that maybe 100, 200 of our citizens, families, and friends die. But how many people die every day from health related diseases? We are the second largest contributor to infant mortality in the world. The same for maternal mortality. Preventable diseases such as malaria, treatable diseases, diarrhea, HIV keeps killing people at every point in time. Beyond that, education is also a very big issue for us. Nigerians are the greatest wherever we are. We are very proud people. And all the professionals, even when you look at brain drain, even in the health system, they say we contribute the largest number of health personnel everywhere. If you are in the UK, you are bound to be attended to and you are giving birth by at least a Nigerian nurse amongst the personnel. But what is happening to our education system? 10.5 million children out of school in this same Nigeria. Beyond the 10.5 million children out of school, every year the standard of education keeps dwindling. These are part of the issues we are putting before the political parties to debate and tell us what their master plans are on. Not just what they have in their manifesto per se, but how they hope to implement this when they get into office.
We are looking at two very critical sectors in Nigeria, and those sectors are health and education. Will we begin with the health sector? Your two parties are running for the office of president, members of National Assembly, governors at state level, members of state houses of assembly at every level. What will be your party's blueprint for reviving Nigeria's health sector?
The major plan of the APC is to focus on prevention. We believe that it is cheaper to prevent people from falling sick than allowing them to fall sick. And one of the most common diseases in Nigeria is diarrhea. Ordinarily developing a culture of hand washing, like we did during the Ebola virus, can cut away exposure to a very large extent on diarrhea. Now, if you look at the current structure, about 70% of our health spending is concentrated in the urban areas. But the majority of the people who don't have access to healthcare services are in the rural areas, people who are poor, people who cannot pay. Now, the APC strategy is to ensure that the current very limited coverage of 3.5% in the health insurance is broadened to cover people in the informal sector, of course working with the state government. So the focus is one, prevention. The second one is expand health insurance to cover the informal sector and ensure that people no longer have to dig their hands into their pocket to pay them they fall sick. The third approach is how do we need to re-examine the entire process of training our medical personnel. For example, does this country know today how many gynecologists that we need? Do we know how many ophthalmologists we need? Do we know how many pediatricians we need? These are the difficult work that need to be done. How do we train them? Majority of our training, our officers, doctors still do their training abroad. They don't even have the opportunity. Only yesterday, the PTP government announced that it's banned overseas training. And this includes medical doctors.
Our country was attacked by Ebola virus. And you notice we became the first country in the sub-region to actually bring that down because the Ebola was a direct attack on the public health delivery system. That tells you that Nigeria's public health delivery system is robust. As I speak to you right now, our country is polio-free. For the past 6 months, no new cases of polio has occurred in Nigeria, and that is why we have achieved that status of being declared polio-free. We are doing quite a lot of things. Our intentions is the new investments in the health sector will not only provide jobs, but it also dissuade Nigerians from traveling abroad for whatever you call it. As we provide the new health facilities that we need all across the country, so will Nigerians not only gain jobs, but also continue to do more to train themselves here, and that money that will be spent abroad for medical tourism will be spent locally. We have done very well in the health sector.
You must be aware that Nigeria is clearly off the mark, off the track in meeting the MDG targets for maternal, newborn, and child health for 2015. As a country, indices continue to be unacceptably poor. Nigeria's current scorecard for under 5 mortality stands at 128 per 1,000 per bed, far away from the MDG 4 target of 70 deaths per 1,000 live beds. And while the maternal mortality ratio is currently 576 deaths per 100,000 live beds, away from an MDG target of 250 deaths per 100,000 live beds. Now, what will your government do to bring hope to the Nigerian mother and child if you are elected to pilot the affairs of Nigeria?
The health sector already has a 5-year plan, which is all encompassing. And this is not outside the MDG target and equally the national target. I am afraid I don't know where the statistics is coming from, but taking the statistics of 2008 and 2013, 545 over 1,000, now 350. That is what is on ground.
These statistics are coming from the World Health Organization. That's the authority in that area.
Okay, we're speaking about our national health here, and our own statistics. We should be able to trust on it. And at the same time, I want to remind us that the health sector in this country has made considerable achievement towards MDG target of 2015 in the area of child mortality rate. Yes. It has so dropped, more than 50% drop from where we are in 2012. And 82%, for instance, in 2013 is the record we have regarding under 5 mortality. So these are the records on ground. So I would like to use this opportunity to remind us that we need no reminiscence where we are like 10 years back, as if that is where we are right now. The health sector is making tremendous achievement to give Nigeria the best health environment that we can ever dream of.
See, like my colleague said, we believe it is cheaper to prevent diseases rather than to treat them. And we also recognize the fact that only 3% of our people are covered by any form of health insurance. So we are having a health, program which is based primarily on making sure that nobody travels more than 5 kilometers before he or she can have free health services or drugs. We are going to build our healthcare system on providing more midwives, providing more community health workers. We're going back to the old days where we are going to have dispensaries and clinics, mobile clinics and mobile dispensaries. Now, certain things are important for health, and two are very important. One is access to potable water. The other is the environment within which you live. Now, without access to potable water, and without every Nigerian being able to live in a very clean environment, you find it difficult to prevent even disease.
How will your party address the problem of incessant industrial actions.
The medical doctors that were going on strike were not just simply asking for more money, as we made to believe that it's about more salaries or more allowance. It goes beyond that. Of course, that's an important issue.
Yeah.
But from what I've seen, it is clear that what they are also demanding is a total restructuring of the entire health system architecture in the country in a way that will allow for optimal utilization of capacities.
Absolutely.
And make them feel fulfilled that they are serving people. You need to go to some hospitals in this country. On the condition, you see the conditions under which doctors work. And I think call duty allowance now is maybe 5,000 or something. You see, so, and when we have the biggest challenge of sending doctors to the rural areas, then you will know that you have to look at this issue of incentives. But how do we prevent it? Prevention is to ensure that agreements reached are honored. When people sit down with government to negotiate, they must have the faith, they must have the confidence that whatever they agree to will be respected by government and all the parties involved. So I think that's the most important way. There will continue to be issues there because we are talking about processes, but the most important way to, I mean, the APC government is not going to sack health workers because they've gone on strike at the point where we are facing a very serious public health challenge. So that is what the APC government intends to do. But more importantly, if you realize that we have about 10,000 Nigerian medical doctors in the US alone, and about 3,000 in the UK, then you ask yourself, how many doctors do we have left in Nigeria and where are they? So these are the biggest challenge. We don't even have these statistics. So the work we need to do goes beyond throwing money around and say you are building hospitals. You need to build hospitals, but the systems, that is where the work is.
Industrial strikes alone in the past 5 years are responsible for the upswing in our country expenditure. Those industrial strikes, some of them demanding money, actually caused a 55% increase in the recurrent expenditure of the country. That's why today it's so difficult. We have about 75%. And of course, you cannot stop people agitating for a better life. So it goes beyond the politics that you have the medical professionals fighting against the medical services providers, which we know, and which of course we don't try to get in, but try to give proper advice to the National Assembly to treat the doctors as the head of whatever medical institution that you have. But what you have, as you have seen the argument rage on, it's actually a carryover from the past, the days of dictatorship, where some people wangle that and suddenly put some other people over medical doctors. I believe in every hospital that the medical doctors should head, and that's why we're also working to provide for a Surgeon General of the Federation.
You all will attest to this, that gender inequality are the fueling agents of HIV and AIDS epidemics in Nigeria. So how will your party, PDP or APC?
That's coming to you.
Hello?
Go ahead.
So how will your party, if in power, uphold gender equality, number one, then protect women and children and girls against child marriage, forced marriage, arranged marriages, inheritance and inequality between sex?
There's already a national policy on gender addressing all those inequalities. But for the benefit of today's discourse, let me just get down to the issue of gender and HIV/AIDS that we talked about. Apart from being a woman, you also know that the issue of gender, the issue of HIV/AIDS in our health sector is already improved. As a few days ago, the president signed into law the Discriminatory Act. So female are all part of that. If there's any HIV/AIDS woman now, you're no longer going to be discriminated in terms of employment, in terms of having your social life ahead of you.
So you also know that the PDP in government has done a lot in the area of reducing transfer of HIV/AIDS from mother to child. You are aware of that. The percentage rose up to about 70% according to the statistics. So, and the PDP is seeking the 5th mandate now to make sure that in the next dispensation, before it finishes, HIV/AIDS would have dropped to at least 2% in our health sector.
You see, the honest truth is that we have today too many ineffective agencies coordinating our health matter, and that is why we're where we are. It will interest you to know that the entire spending of federal government on health is only 5%. This we intend to raise in the next 4 years to 10%, and in the next 8 years, hopefully to about 15%. Now, unless you increase the amount of spending on federal health, you are not being able to address the issues at stake. Now, we're talking about the issue of HIV. I think this all has to do basically with what is the policy of a party as regards, women. And this is where I believe that we in APC, we are far ahead of the PDP. Because until you address the fundamental issues and the laws that discriminate against women, you will never be able to get, gender equality. And this is why one of the first things we intend to do is to improve anti-discriminatory legislation to afford women equality and equity in employment, in education, in health. We also intend to legislate and protect women's right to own property. We will also legislate and enforce protection of fundamental, human rights of women. Until and when you do this, you are not going to be able to protect women, adequately.
I want the political parties represented here to tell us how they hope to implement policies on health sectors as regards rural communities, because most of our rural communities, some of them don't have health center.
It's not in every village that you can have a doctor. But believe me, most of the ailments that afflict our people can be resolved if you have trained community health workers, people within among them. If you have midwives, we are going to prevent a lot of maternal, death, traditional birth attendants and the like. And we also explain that our policy is such that nobody will need to travel more than 5 kilometers before he or she can access, any, healthcare service. And we are going to make sure that we have free drugs and free services at local areas for at least the primary health care.
About 1,500 primary health centers are already refurbished. And in the policy of the policy thrust of the party health is to have primary health facility in all the wards, and general hospitals in the local government, special hospitals at the state level. And all these are in the National Health Plan, already ongoing. Also, the community-based health, we have about 12 states that are already practicing that right now. And I'm sure some people in this hall may have benefited from this. So it's not like PDP is trying to do it. PDP is already doing it. And there are the teaching hospitals as well are being refurbished, like the Uniben and UNTH, Enugu. So policy thrust of PDP health is to bring Nigeria to have a very healthy Nigeria before the end of the next dispensation.
The people do not seem to feel the impact of what you claim you have been doing at these levels. What is the challenge? Why has it been impossible for you to cater as political parties that run governments at different levels to the needs of the rural people in Nigeria?
If you look at the heart of most failures of government programs, is the governance of it, the way it is structured. we all agree that the most important tier of health care that our people need is the primary health care service. Now, this primary health care service, which level of government is it entrusted to? Local government, the weakest of the tiers of government, is the tier of government that Nigeria entrusted with the most important health needs of the people. So, and these are part of the governance restructuring that we are talking about. Unless we create a system that allows across board for federal government to prioritize the intervention at that level, then it's not going to work. We're in this country when Professor Lukoye Rason-Kuti was Minister of Health. So that was the last time that a federal government is able to directly impact on the health level, health profile of the people at the lower level. So some of these challenges we're saying is governance challenge, and unless we are ready to reform that, no matter the amount of blocks and cement you throw at it or money you throw at it, it's not going to work.
I recall on television some time ago, it was me and Mr. Lai Balogo, Mr. Lai Mohammed, dealing the issues about autonomy for the local governments. Now, we thought the local government should be allowed to have the autonomy. Mr. Lai told me no, that the local government should not. That legally, he threw some legal stories why the local government should not be allowed to be autonomous. And I'm happy, Honorable Minister, have now stated this issue. It has to do with the governance structure. We, the PDP, believe that the autonomy of the local governments, as enshrined in the Constitution, should be availed to local people so that they'll be able to impart on the local people. The APC doesn't think so. They think gripping the structure of the local government and using the resources and money for the local government to fund their party is the way to go. That's why we have that governance problem that he's talked about.
Yes. I think my colleague here has a very poor understanding of local government autonomy. What we argued was that in a federation, there are only two federating units, the federal and the center. No amount of juggling will change that in a federation. That is the law. Only two units federate. And that's why we said that there are not three tiers of government in the federation. It's only local government, it's only state government and the federation units. Secondly, I don't think you seem to understand what the Honorable Minister said. What the Minister said is very simple. He said that as long as local government, as they are presently constituted today, they are saddled with responsibility for primary health care. They have neither the resources, nor the infrastructure, nor the personnel to carry it through. And that we need intervention at either state level or federal level. I don't know why that is difficult for anybody to comprehend. That's exactly what he said. Now, what we are saying, and see, we are responding to this, saying that go to any APC state. And I will take Lagos for instance. Lagos has the highest number of mother-to-child clinics. When Ebola broke out, it was lucky, we were lucky in Nigeria that it broke out in Lagos, it broke out in Rivers. Because these are the states that already had the infrastructure to handle it. If it had broken out elsewhere, God will have saved this country. Now, not that, you see, when they come and say the federal government stamped out Ebola, I begin to ask, which federal hospital was Ebola treated? Not one. We all know it was only in two states. That was, Rivers and Lagos. We quite appreciate the fact that the federal government did a lot in advocacy. They did a lot in ensuring that it does not spread inside the country, which we acknowledge. But for you to come and ignore the role of the states, which bore the brunt, which lost lives, lost doctors, lost health personnel, and start, singing a glory that you do not even contribute 20% to. I will give an example. Rivers spent about 1.6 billion on Ebola. Federal government gave Rivers 200 million naira after they have conquered Ebola. Ditto in Lagos. So when we want to state facts, don't let us mislead Nigerians. Don't let's be emotional. Let's face facts for what they are.
The National Health bill was signed into law. So it's now a National Health Act as of December 2014. And I want to ask, if you have read it, because that's the question, if you have read it, do you believe that it provides the way forward for resolving the contradictions in healthcare delivery and better health outcomes?
It is a very good move for us to actually have that Health Act. As you have seen, after that act came in, there were strikes, and part of the strikes were some of the protections that are in there. Some people were arguing about people being put on top of them. And that's why I say no one law is perfect for everything that we want. So now that it has become an act, we are beginning to listen to the disagreements with some of the things that are held in it. And I agree, and that's like I mentioned here earlier, in the argument between the health providing professionals and the professional doctors. They are saying that one man shouldn't be on top of the other man. And we thought there were a lot of things that we may not have known that have gone into that thing. But through these agitations, just like I said earlier, we will now probably look at what is it that is not there that people think we should have thought about differently. And that's why it's a very dynamic human society. Whatever you see in that act that is unacceptable to you, if you think amendments should be made, you bring a proper position, articulate it to government, and that's why you have amendments coming every day. So no one law is perfect for any human society.
With dwindling receipts from oil in the last few months for the country, how are we going to fund all of these things that we hear you saying you're going to do? If government is having a decrease in their funding, what role also will the public and the private sector actually play in actually providing healthcare services? Because government will not be able to do this.
You see, yesterday, after waiting for, I think, 15 months, the Federal government came with the report saying that the firm of auditors that they commissioned to do a forensic audit on the missing 20 billion said only $1.6 billion was missing. $1.6 billion today is well over 300 billion naira. Now, we know it's more than that. There's 245 billion pension scam we can't account for. There is 2.6 trillion subsidy scam we can't account for. In other words, if only we can plug the corruption, there will be enough money for health. That $1.6 billion is more than what Lagos and Ogun State, more than what Ogun and Osun State will collect in 1 year. So you see, it's not just about dwindling resources. It's about how do you make sure that what you take, you keep. And don't forget that we are told that we lose 400,000 barrels of crude per day. That is the equivalent of what Equatorial Guinea produces in 1 day as a whole country. So I can assure you that all this thing about dwindling economy is all about corruption. After all, the price of oil has gone down in Angola and everywhere. They're not coming to the economy because the money they had, they invested it wisely. They did not, steal it. So once we can stop that leaking, that bleeding in our national treasury, you can very reasonably, do what we are doing. And of course, everybody that has watched the cycle of oil prices, we know that it goes up, it goes down. It's the important thing that what do you do when you are making around $10 per barrel? Clearly, a government that could not invest in healthcare system when they were making around $10 per barrel cannot do so when they are making $50 a barrel. Thank you.
It's very expensive to deliver health care. So the question is in the direction of public-private partnership, which the PDP in government is also availing itself. It has already signed an MOU with the General Electric to provide specialist hospitals in some of the states. This is to also enhance the health sector delivery in this country. And let me point to the area of corruption, that government of PDP is not in any way enjoying corruption at all. And as a result, initiatives are already in place to make sure that it's stamped out. For example, in the civil service, and I'm not sure, all of us seated here, I'm sure, are aware of the IPPS system, the integrated payroll system, that has saved this country 340 something billion naira, recovering about 50,000 ghost workers. These are all initiatives towards curbing corruption. You look at the e-wallet system, for instance, providing fertilizers to the people that are going to use it. In the past, 10% gets to them, now about 90%. So PDP is marshalling out initiatives and programs to curb corruption. So we are not in any way enjoying corruption. That is just an answer to my colleague here towards corruption. So we are, for the benefit of this discourse, health sector is very expensive, and the party is availing itself with the private sector. And we are seeking this fifth mandate in order to implement the next stage of development in the health sector. We cannot just emerge overnight and then all of a sudden all the hospitals and everything is working. Nigeria is still a developing nation and is putting in place measures on ground to make sure that the health sector in this country is something we can rely upon.
I would like to know what your parties are planning concerning teachers. Teachers' welfare seems to be very responsible for most of the issues we have today. I'm also worried about the fact that most teachers in most states, especially Kogi State, for example, are not paid minimum wage. How are we going to improve the quality of education with respect to teachers' welfare in your manifesto?
I'd like to tell you that the PDP in government is taking cognizance of all this. There are programs in place, initiatives to improve on the quality of teachers, working with the NTI, that's the Nigerian Teachers Institution. They are working on the quality of teachers. As well, I also want to remind us that there are grants already in place. 3 billion naira to some selected universities, 1 billion to polytechnics and colleges of education. And components of these funds are also in terms of training and retraining of teachers to make sure that it's not only having access to quality education, having access to enrollment, but as well as having access to quality education.
No nation can rise above the quality of its teachers. And you see, all these things that we keep counting numbers. Oh, we spend this amount of money, we build this number of classrooms, we bought this number of books, will amount to nothing unless we put the teacher at the center of our drive to improve the quality of education. How many times have we had it in this country that majority of the teachers we have in primary schools are not even better than many of their students? You see, this is a big problem. And it has to do with, one, what kind of people do you incentivize to go into teaching? How did people get into teaching? Look at the the curriculum for the colleges of education. The curriculum, until about 2 years ago when we raised the alarm, the curriculum for the colleges of education has nothing to do with primary education curriculum. Yet, the national policy said when you have NCE, you will teach in primary school. And the curriculum you use in training teachers at the NCE has no bearing whatsoever. NCE has become a stepping stone to go into universities. You see, so the question is, how do we need to refocus on the curriculum of the colleges of education and tailor it to the curriculum of primary education. That is one. Two, how do we ensure we give on-the-job quality training to teachers? A lot of interesting things are already happening across the country, supported by international donor agency. But how do we scale it up to ensure that teachers get on-the-job training? Thirdly, how do we incentivize brilliant people to take up career in teaching? You know, because as long as someone came to me once and said, please help my son to get a job, even if it is teaching. So In other countries, in Japan, for example, it's only the most brilliant and the brightest that teach in primary school.
When people are asked to bring figures or data, they automatically think it's going to translate to higher resources for the federal government, or it's going to translate to more constituencies for them. It's going to translate to more, benefit. Because everywhere in the world that I know, the issue of data is birth and death, mostly. And they should be left to, at worst, the state. There should be enough trust between the center and the federal units for you to be able to rely on the data being supplied by the states. Because when people give birth, they don't give birth at the federal capital. They give birth where they live. When people die, they die in situ. Now, so there's need for that, synergy and trust between the state, the local government, state, and federal level. Two is that, like I said, we must not look at simple issues of data as being political. Most of the figures we are working with today are completely exaggerated. I'll give you an example. When the GSM was introduced, I know 2 companies that hired international consultants to give them data to convince them whether or not she should participate in the auction. Working on the data available, the consultant advised them that it would take 5 years for the subscribers, for the company to have 1 million subscribers. Based on that information, they refused to participate in the auction. It took less than 6 months for both, then I think it used to be Celtel, Econet, and the MTM to reach 5 million. The death of reliable data, that's what it cost them. Now, today, we work with data which we cannot even, the integrity of which we are not sure of. So please let there be thorough decentralization of data and let people don't look at data as, political. And I think that's what we could get there.
The other question has to do with UBE.
Yeah, I think, yes, it is true that many states today are yet to access the UBE funds. But what we are not being told is that UBE funds are not accessible without, meeting certain conditions. The first is that you as a state must be able to meet your own counterpart funding. 2, you must also be able to show the federal government what we did with the last the last UBE fund you took. But I think the real problem about UBE is that states are very upset that the federal government will nominate contractors to come and do projects, for them on UBE.
Let me tell you my experience where I like this talk. You see, you say I bring 1.2 billion, you give me 1.2 billion. And you tell me that 70% of that must be used for infrastructure. Now, if I think my priority is teacher training, for example, then I'm obliged to spend that money on building infrastructure once I collect it, regardless of whether 50% of it is my money. You see, this has discouraged many states. So they say, okay, keep your 1.2 billion. Let me keep up my 1.2 billion and spend it on what I consider to be my priority. That is one. The second element, why should federal government buy books for states? You see, this is a major problem. When I was commissioner, a publisher brought a book to me, very good books. But these books presume that children have done 2 years of pre-primary education. But we know that majority of children in public schools come straight from their home into primary 1. So these books did not account for that. But when someone sits in Abuja and now award contracts to publishers to supply books to states, then it's not going to work. So you see, so what we are saying is that There are a whole lot of governance system here. APC is a federalist party. We believe that states should be allowed to do the work that states are constitutionally charged to do, while the federal government set the overall policy and standards. But all this is about people awarding contracts. That's what is distorting all these.
Thank you very much. PDP.
The issue about data, you're very correct. It speaks the truth to our history. We are a developing country. Just yesterday, there were no data anywhere. But of course, there are data today. That's why we're having the arguments about somebody bringing a spurious certificate that we say, no, it's not true. Data elsewhere shows that that certificate doesn't exist. So, data are very, very important. And we believe in education. That's why we insist that people should do those things that they say they will do. Now, I can give you that there is already data in Nigeria. A lot of people are building their own data because I know when the police started building its own data. Today in INEC, we have problem about data, about the data that they should provide the citizens not being yet given to up to 20 million people. And that's why some people are saying, oh boy, are you ready for the elections? So issues like that data, yes, you need to understand because some of the things that go into data provision are not procured locally, just like the INEC crisis seems. If it were a local contract with the Nigerian minting company, I don't think we may be where we are now. But because they have to expect foreign contractors to provide them with those data cards for more than 25 million people, that's why a lot of people still do not have. Please, we are a developing country. We are doing the best that we can. But of course, we mean very well in issues of data. That's why we're insisting that whoever says he did WAEC does have their own word, databases, and bring your certificate. Let us see if it is real.
I think it also borders on the governors beyond the federal government, especially with the UBEC fund. And this is where we need to address the critical issue beyond political affiliations. The UBEC is not only about federal government, and the fund domicile there is owned by Nigerian people. It is deducted from the federation account. So the governors don't have the excuse of saying, because UBEC is giving that condition, then you allow that money to be stolen because it is not utilized. That is one. Because once it is there, domicile and not tapped, then somebody steals it. Then we will start looking for how 54 billion naira disappear from UBEC. That is one. Two, with the case of insecurity in the Northeast and with the experience with the Chibok girls, pending when the crisis there is resolved, how do we guarantee the safety and security of the teachers, the properties, and in terms now looking at the classes that have been built, and then the children that will be going there? It is not just about those military going there. There must be a strategy from the parties that clearly addresses these issues. Thank you.
Well, I think nothing advertises the incompetence of this government more than that one single issue of the kidnap of 260 girls in broad daylight. You see, people start talking about how do we guarantee the lives of teachers, the lives of people who are going to conduct elections. Do you know today how many Nigerians in the Northeast are internally displaced? Do you know the mindset of the average person from the northeastern part of Nigeria? The insecurity. You see, until you have a holistic approach to counter-terrorism and you are able to secure Nigerians, you cannot even secure just the teachers alone or just secure the INEC officials alone. It's a crying shame that we will be living in a country and children will be kidnapped on a daily basis and the government will have absolutely no answer. What is even worse, that it took this government a whole 10 days to even accept that these girls have been kidnapped. Talk less of looking for them. And we are campaigning for election today, for president, for re-election, and nobody is talking about what is happening to those Chibok girls. Nobody is talking about where they are. They have relations, they have mothers, they have fathers. But this may be being swept aside. And what are we entertained with? Irrelevancies. Now, to go back to your question, sir, until and when you have a real commander-in-chief that can secure the whole of this country, and not just teachers, I think we are just joking. We need a commander-in-chief who can assure me that whether I live in the northeast, or I live in the southwest, or I live in the south-south, I will not be a victim of militancy, I will not be kidnapped, there will be no armed robbery, and there will be no insurgency. That, I think, is the situation.
President Obasanjo was president of Nigeria, and then the politicians in the northeast and the northwest introduced the political Sharia. That was used to radicalize those areas, and the Sharia mutated today into the violence you call the Boko Haram. And this is what it is. So we are saying, still to go there, these same politicians are the ones that have run into the APC. And that's why we're saying most of them who are there are the ones who know the truth about not only the kidnappings, but also the violence in the country. Let us tell ourselves the truth. The fact that Masob were peopled by Igbos doesn't mean that me and Igbo agree on their strategies in resolving the Nigerian conundrum. We also saw this in the Southwest with the OPC formed when the young people of Yoruba land were not happy with the way their elite engaged with Nigeria. So I believe in resolving the insecurity problem in the Northeast and the Northwest. We have to consult the elders and the elite of those areas, just like we did in Niger Delta, to reach out to the young people and stop this violence.
From my assessment, in Zulu Nigeria, I know that one teacher, one primary school teacher teaches all the subjects, both mathematics, English. And that's the perception that children finish from primary school with the perception that mathematics is a very difficult subject, definitely, and they will fail in their WAEC or NECO. So my question is, how do you intend to ensure that professionals in that field teaches those subjects?
One of the major challenges for that is the nature of the primary school curriculum. I think today they have 16 subjects in primary school. I think about 16 subjects in primary school. I mean, what is it, 12? I mean, what we're saying is that whether it's 12 or 16, the important thing is that we have too many subjects we have too many subjects in primary schools. We need to reduce the number of subjects, because what does a child before the age of 10 really need? Ability to do basic arithmetic, ability to read, and ability to write. Any other thing is just addition. So we need to streamline the curriculum, and that's what APC intends to do. Streamline the curriculum in such a way that children will leave primary school literate and able to do basic arithmetic. Now, that would also change the nature, because in primary school, actually, it is possible for one teacher to teach all the subjects in one class. That's what you call class teaching, rather than subject teaching. So, but if you have 16 subjects, there's no way one teacher can teach all the number of subjects. There are some villages that teachers don't want to go. And it means that you have to provide accommodation, you have to provide all that, and they still don't want to go. Now, the solution to that is to make the number of subjects manageable in such a way that a teacher who has gone through secondary school and NCE should be able to teach primary school literacy, should be able to teach primary school numeracy. It becomes a problem when you get to JSS3 and you have integrated science and all that. Then you have to direct the attention. And that is why the NCE program covers not only primary school, but also JSS3. So these are all part of the systems reform that we are talking about. And unless we focus on these difficult, but they are very difficult issues. Unless we focus on these very difficult issues, we are not going to be able to solve the crisis in our education sector.
I don't think the problem should be about just curriculum, like the last speaker just said. Be that as it may, I want us to also recall that the PDP in government has done a lot in terms of curriculum at all levels of education, both primary, secondary, and even JAM. I think what the problem is there is what we're already addressing as part of the initiative. Training the teachers so that they can turn out to be quality teachers. If you are a teacher and you're able to take test subjects effectively, I don't think there's anything wrong with that. But in order not to labor the teacher so much, the PDP in government is also having that policy in mind to make sure that at least a teacher can only take 2 or 3 courses at a time in order not to overlabor that teacher. And to do that, you agree with me that the budget of the federal government has tripled from 2007 to date, so that we'll be able to engage more teachers into the classrooms to reduce number of a teacher taking so many subjects like he pointed out. It's not all about the curriculum spelling out a lot of subjects at the same time. It is all part of education. You don't have to just do basic this, basic that. At what point will you now engage that pupil again to begin to learn what he or she needs to learn at that point?
Nigerians will actually be holding the political parties accountable, whosoever emerge at the national or at the state level, accountable post-election. And to all, everybody will say thank you, and the discussion continues.